This is KTVO's Good Morning Heartland.
And as you know, October is Breast Cancer Awareness Month, and over the past few years, there's been a lot of debate over mammograms. Who should get one? When? Are they really necessary? Now, organizations such as the American Cancer Society and the Center for Disease Control say mammograms can save lives and should be a part of an everyday woman's health regimen. And this morning we have Dr. Margaret Wilson. She is a dean of ATS Still University, Kirksville College of Osteopathic Medicine, to talk more about breast cancer. How are you doing today?
Good morning. Very well, thanks.
So we have some video of, mammographies and women getting mammograms done. So let's go ahead and talk about breast cancer. We know that it's very common among women, but men can also get this as well, correct?
Right. Men can get breast cancer. We're actually seeing some increase in that, although, again, it's very rare, and the vast majority of breast cancer cases are going to be with women.
Okay. Now, are there different types of breast cancer?
There's several different types of breast cancer. Most of those are pathological differences.
Mm-hmm.
You wouldn't necessarily note them, if you found a lump or certainly anything like that.
Okay, now let's talk about screening and tests available for women. What can we expect and what is available out there for women?
Well, of course, the most common screening test is mammography. And again, that's the one we want to promote it in terms of prevention for the average woman. There's a lot of other tests that could be used. MRI might be used, particularly in a woman that had a very high-risk family history, or perhaps she had a history of breast cancer previously. Ultrasound is sometimes used if there's some question with the mammography. So, most women are going to be looking at mammogram in terms of their usual type of testing.
Okay, now before we go into detail with that, let's quickly let our viewers know, obviously they could check themselves. What should they look for when they're checking their breast to see if there is any abnormalities in there?
In terms of self-exam, you might find a lump. You would be looking for a lump, or even just any kind of change in the texture of the breast tissue. Maybe it feels thickened. Skin changes can also be a sign of breast cancer. Sometimes there might be dimpling or change in the color or even rash over the breast tissue. But the unfortunate thing is most breast cancer is not going to be found. There are no signs. It's going to be detected on mammogram.
Right. Okay, so now my next question is mammograms. A couple of years ago, or even when I was younger, when we would learn about breast cancer in sex education classes, we always learned that, once you get into your 40s and 50s is when you start thinking about getting tested. But nowadays, I feel younger women more and so often are starting to get breast cancer at a younger age. So what is the age that experts recommend for women to start getting tested and have this be an annual exam, or every other year, whatever the recommendations are?
Yeah, that's one of the problems, is there's not necessarily consensus on when to start or the frequency. Most specialty groups are going to agree around age 40 is probably the usual time to begin screening. If you have, again, a strong family history, there may be indication to start that earlier. Right now with mammogram, everyone agrees that women should get them. There's still some disagreement on whether you should get them every year or maybe every 2 years. I think that's a discussion to have with your doctor, but definitely most important, remember that they should talk about getting that with their physician.
All right, so with somebody my age, I'm under 40, can I be able to go and get a mammogram done if I were to ask that from my doctor, or are they going to say, you're a little too young, maybe wait a couple more years?
Again, it may depend on your personal and family history, whether they recommend you certainly may get one under the age of 40, or they may suggest that you wait a little bit later. Again, it's going to be kind of a personal decision and discussion based on your own risk factors and your physician or practitioner's recommendations.
Okay. And really quickly, can you just explain what the test entails for somebody that's never gotten one done? I hear sometimes it can be painful, or, it's a long test. Kind of just talk about that.
Well, I think mammogram has improved a lot over the last few years in terms of comfort and the amount of time it maybe takes to do the actual test. They're going to compress the breasts in the mammogram machine. There can be some discomfort. For most people, it's not going to be anything, too much. It'll be tolerable. So expect a little bit of pressure, discomfort, but The techs are very good about trying to make it as quick and less uncomfortable as possible.
Okay, and what are some types of questions maybe a patient should ask their doctor if they believe they found a lump or have signs of breast cancer?
Yeah, the first thing I'd say if you found a lump or any kind of change that you're a little bit concerned or unsure about is get into your provider, get into your healthcare provider, let them examine you, let them make recommendations as to any tests that might need to be performed like mammography or ultrasound. And you know, don't stay at home wondering. You know, get in there and get it checked out.
All right. Anything else you'd like to add?
You know, again, it's Breast Cancer Awareness Month. I just encourage everyone to have that discussion and remember that, you know, mammography can screen and detect cancers early, and please have that talk with your healthcare provider.
And even though October is dedicated to Breast Cancer Awareness Month, this is something that we should think about all year round.
Oh, right. Yeah, exactly.
So, all right. Well, thank you so much, Dr.
Right,
Wilson, for coming on. What we'll do is we'll post everything on our website at heartlandconnection.com, and we'll be right back.